One thing we know about COVID-19 is that it has taken some unexpected turns at times. So predicting what to expect in a coming month is not easy.
And so this is kind of a late ad.
In fact, it has OHSU's Peter Graven working into the holiday weekend, getting a handle on the outlook for July. The late adds into the mix are Omicron subvariants BA.4 and 5 that have come on strong in Oregon.
We didn't really know exactly what the impact was going to be. There's some speculation, and now I think we have a pretty good idea that indeed we will see some increased infection rates.
In fact, health officials say the subvariants are now responsible for more than half of new cases. The spread has the CDC upping the COVID transmission risk level to high in most Oregon counties. All the red on this map is high risk, including our most populated places.
More and more we're going back to kind of normal levels of social interaction.
Oregon Public Health's Dr. Paul Cieslak is not surprised by the CDC's take.
A lot of people are getting COVID, and then, they are spreading it to some people who are being hospitalized by it. Probably predominantly people who either haven't been vaccinated or who are at risk of severe disease despite vaccination because of underlying medical conditions.
In fact, we've watched the number of people hospitalized with COVID going up in June, and this week a mini spike with hospitalizations going from 357 to 399 to 402, and the latest today, 418. Graven had predicted a plateau mid-June, but says it was actually a lesser-known subvariant, BA.2.12.1, that upset that prediction.
That mostly just kind of extended the time that we've had this higher infection rate, and I expect BA.4 and BA.5 to do something similar.
Okay, Tim Gordon joining us now. Tim, obviously we don't like to see those hospitalizations going up, but you do have a little more context. You dug into the numbers there.
Yeah, we go a little bit deeper on this, Ashley. Experts say that more than half of the cases in hospital are what they call incidental cases. That means they were patients who came in for something else, but then tested positive. So that actually tells us that the seriousness of the illness is less than it is like with Delta, certainly.
Okay, so a little bit of good news there. So everybody wants to avoid COVID right now, even though it's spreading through the community. This weekend is going to be a busy one for people with gatherings and whatnot. So what do we need to know?
Well, it's a good thing that the 4th of July is kind of an outdoor holiday, right? We like to get out and do things outside with folks. And Dr. Cieslak says that's good. Obviously, avoid indoor gatherings, but he's fine with outdoor gatherings, even big ones. So, it's airborne and outdoors. It's okay.
Okay, so this is hitting at the good time of the year with good weather to be outside. That's obviously, though, advice for people, especially in the high-risk category. Maybe avoid those gatherings. Yeah, this is good advice for low-risk folks. That's people that don't have preconditions or, definitely vaccinated and boosted. That is the best way to stay low risk. Okay, well, I know you'll keep us up to date when we get that OHSU forecast for COVID. All right, Tim Gordon, thank you.